We have already made a difference. I've been in the bowel cancer field for 30 years. We've doubled the survival, but the survival is still only 60%. And we can certainly get beyond that. Now, we don't have the tools to do that at the moment, but those tools are in development and hopefully that will improve the situation. The aim of this programme is to really ensure we're doing everything for patients that we possibly can do, that we are performing to the optimum level that's possible, and where we're failing, we know that, and we take actions to do something about it.
The Yorkshire Cancer Research Bowel Cancer Improvement Programme is trying to prevent a postcode lottery across the county, and we're using data to try and quantify any variation in care and then make sure it's addressed. And without the programme, this wouldn't happen.
So I was appointed just over 10 years ago to Leeds Teaching Hospitals as the Bexley wing was opened, and it was an amazingly exciting time, and it's continued to be a very exciting time to work in this amazing hospital with amazing colleagues. We've developed a network. We're working as a large team for Yorkshire and Humber. We're making the same decisions. We're adopting new findings quickly, and we're in a better position to support new and exciting research opportunities. It's saving lives both by providing more effective treatments, but also meaning those treatments are safer and causing less harm. So it's saving lives in multiple different ways.
We collect the data to try and get the best picture possible of what is happening for bowel cancer patients across the county. We link together as many data sets as we possibly can to get the richest information available, and then monitor care and outcome across the whole region. So which hospitals are doing well, which are doing less well, and then use that data to feed back to the hospital teams so that they can look at their outcomes and try and improve.
We found that the Danes have recently made quite substantial improvements in their survivals, and so we've been looking at what they do and what we don't do in order to try and improve what we do so that we can establish those same gains in the Yorkshire population. We want to make Yorkshire the best place, if you've got to get bowel cancer, to get it so that we can get the best possible outcomes for you all.
I was first diagnosed with bowel cancer in 2009. I had my operation. They gave me a temporary stoma, which I had for about 12 months, and that was reversed, and then started my life with a new normal. I think the Bowel Cancer Improvement Programme, funded by Yorkshire Cancer Research, is very important because it collects together all the different studies that are going on into one place so that new teams of researchers have access to data that they wouldn't normally be able to find. I think the impact in Yorkshire will be that the outcomes will be a lot better from bowel cancer, and that's what we're aiming for.
I was first diagnosed in September 2014. At that time, the chances of surviving 5 years with stage 4 bowel cancer were less than 10%, but we're now at 6.5 years and I'm still here. The fact that I've managed to live a bit longer than it originally looked as I would do because of the benefits of research and all the fantastic medical people who've been looking after me has made a huge difference in my life. I saw my elder daughter married, then thought that I might not be around to see my granddaughter born, but I was, and she's now 4 and is at nursery, and hopefully will have some fairly clear memories of me, which is something I couldn't have hoped for when I was first diagnosed. I think it's really important for patients to be involved in research, in putting their views forward to medical professionals, researchers, doctors, so that they hear from the people that they're trying to treat what really matters to them.
So without funding from Yorkshire Cancer Research, we wouldn't have this programme, and I wouldn't be able to do my job of linking data sets together and getting the richest possible picture of bowel cancer patients and bowel cancer care across the county. It's really important to have these data because through them we can generate intelligence that will drive change and save lives.